All right, it's 5 o'clock. If we could go ahead and call the meeting to order and respect everyone's time. We'll stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so our first order of business today is we're welcoming our newest board member, Dr. Micah Thompson. Yeah. And I know, Mike, if you don't mind just sharing a little bit about yourself so that the board and the department can learn about you.
Sure.
No dancing.
Nothing, what'd you say?
No dancing
or
required.
singing. I'm a native of Terre Haute. I've worked in the Wabash Valley about since I graduated medical school in 1999. So been around for a while, and I'm looking very forward to helping serve the community. My husband is David Thompson. He's on the police department. He's also a member of the county council. And we have 3 daughters, raised in the school corporation here. So we're very vested in the community, and we're excited to have them.
And we were fortunate to have her daughter Sasha as one of our interns for a semester.
Okay. All right, Robin, roll call.
Dr. Jennifer Todd.
We have new microphones, so you just need to push in them. So get your.
I'll start over.
Oh.
Dr. Jennifer Todd,
Here.
Jeffrey DePass,
Present.
Dr. Amber Caddick,
Here.
James McCann,
Present.
sorry, Dr. Micah Thompson,
Here.
and Dr. Lim.
All right. So the next action item is to look and approve the minutes from the last board meeting. Are there any questions or concerns about the minutes?
I'll make a motion to approve the minutes as written.
Second. All those in favor?
Aye.
Opposed? All right, minutes are approved. All right, financial report from Robin, please.
In your packet, you'll see the budget that we put in there, if you have any questions or anything. We did a great job. We had to spend down we spent everything down on our immunization grant. So, for the other counties were called, that they were gonna take it back from us, but we spent all of it.
Indiana had $40 million in their federal funding removed that had been allocated for COVID. And then after COVID, it was used for mitigation for issues that arise during COVID, such as low immunizations. Fortunately for our immunization grant, I guess I was a swarmy and was, reading minds about that might happen, but we spent ours completely down and it didn't affect us. Some counties lost as much as $100,000.
Any questions?
The only question how about the HFI funding that we have from before? Has any of that been impacted or is it about the same?
I was going to talk about that in my report.
Okay, we can pause, yeah. All right. Any other questions for Robin? All right, Dr. Brooken?
Thank you. Nothing really to report directly from the state. Of course, keeping eyes on public health across the country. The M&Ms is what's dominating the headlines with measles and money. So just keeping an eye on those things. So, and as a reminder, it's all about vaccination rates of these spread. About 98% of the cases are in people that are under or non-vaccinated. So get your kids their shots, please. Thank you.
All right. Any questions for Dr. Brooken? No? All right, Joni, it's your turn.
So I'm on INSACHO's Board of Directors, and one of the things we've been doing is following the bills in the current legislative session. So you inquired about Health First Indiana.
Mm-hmm.
Pretty much right out of the gate, there was the thoughts to reduce the funding because they were promised results immediately, some of the legislators said, but we knew that it was going to be some capacity building from most of the health departments. It was agreed upon to cut $25 million in 2026 and $25 million in 2027. They said they need the money for Medicaid, which is really unfortunate. So I'm not for sure how that's going to look for us. The governor should sign everything by the 29th. That's when the session ends. And then we just have a quick turnaround of 30 days to get the budget for 2026 into the state portal. I emailed our contracted partners and asked them, explain the situation as I know it, and said, I want you to think about what is the minimum amount of money that you'll need to continue your programming. And I say that because some of them, they're in their second year of being a contracted partner. And so there were a lot of upstart purchases that they needed, whether it was computers or desks or things like that. And so those are the things I want them to go through and consider, the things that they don't need anymore, but just exactly what they need to sustain their programming. I asked them for their minimum amount, and then I asked them to do a footnote on what they would like to have, so when we look at carryover funds, we can prioritize where it's going to go. We're one of the few counties that has spent down our carryover funds. We have less than 8% of them left. But the last bit of funding, I've been working with Catholic Charities and New Life Pantry on food insecurities and bringing fresh fruits and vegetables to people who utilize those services. I got to be a guinea pig for the HFI budget template for the counties to report on their 2024 finances. It was going to be due in June. I got to be a guinea pig and try it out, so ours is already done and in and submitted, and it's good. The federal funding cuts, again, did not bother us because we had already spent down our immunization grant. I will put money into our 2026 budget for contractual services because that's what we use the immunization grant to have retired nurses come in and work as contract nurses because it's so difficult to get a registered nurse to come in and work for a public health nurse's salary. Even your hospitals have a difficult time and have sign-on bonuses. So imagine saying, okay, I'll pay you $52,000 to come work at the health department. So again, it helps us out to have nurses that want some jingle jangle in their pocket and then really believe in what we do. We had a great showing at the Public Health Day at the State House. We had 4 of our staff go over. I got a nice a text message from Greg Good thanking me for the good show up for Vigo County. And I got selected to be on the core leadership committee for the state, which we're going to talk about the core public health services and how to best direct them. I revamped our core public health service plan. It's not it's not completed yet. I still have a few local KPIs that I need to create. I'm glad that I didn't completely finish it because in the legislature, they're wanting to take out some of the core services, which we could still leave them in and make them our own goal to make sure that they sustain or are improved upon. But it just makes it a little reader friendly than the first one that we did. And I would like you to rat through it at your convenience when you can't sleep at night and just kind of, see where we're at on things. So we accomplished a lot in 2024, and I know that we're going to do the same in 2025. Any questions, comments?
I have one.
Yes.
So I do know the Lugar Center did a comprehensive, 1-year study, a community health needs study.
Mm-hmm.
Has that been presented?
Not yet. Autumn
Okay.
hasn't presented it yet.
Okay.
Fenner.
I think it would be very valuable to be able to see that. They had tons of boots on the ground for many months throughout the summer of last year to be able to look at where specifically our needs are assessed by the people in our community. And so I think that'd be great to be able to hear that before the budget, if we could get that, and I can work with the Lugar Center on that, to get that information before the budget's put in. Maybe to have some targeted, whatever it could be, dollars going towards those areas that are the hot areas for this, that are kind of assessed by our community members.
They are. The one thing about Union's Community Health Needs Assessment is it's for their service area and not Vigo specifically, but that's not to say that we couldn't glean good information from it. But I think that you have to realize, the state sets the core public services of what we shall do, but it's looking at what are the needs and how we can fold those into the core services. But if I can get a copy of that by next week, That'd be beneficial.
I'll work on it.
Thank you, dear.
Any other questions for Joni? All right, so we're on to new business, and Amanda with the full food ordinance.
Hello. So I sent you all our updated ordinance, and this comes about because the state has decided to implement or adopt the new FDA food code. It's been over 20 years since the state of Indiana has updated our food code, so they thought it was time. So I had to go through the ordinance and change all of the code numbers, so it's going from 410 IAC 7-24 to a 7-26. So that was a lot of the changes. I added imminent health hazard and then changed what critical and non-critical is now priority, priority foundation, and core. So our inspections that used to be critical and non-critical are now, when we go out and do the inspection, it's either going to be in compliance, out of compliance, not observed, or not applicable. So that was the main changes to the ordinance, and that's what I'm asking you to vote on tonight so we can implement that, because that all went into effect today. It wasn't supposed to go into effect till like July 1st, and the state told us about a month ago, like, oh, April 16th today. So here we are.
So with the next food assessment, we're going to see in regulation or out of regulation, and no more of the critical and non-critical.
There's a catch to all that.
Okay.
With the state implementing this so soon, we didn't have our inspection forms that say in and out, not applicable, not available. So we're working on getting those printed. We're in the process of having Inspect to Go built. We had it completely built under the old food code, knowing that there was going to be changes to the new code, with the new code. So we're working on getting that implemented with the new code into that program. So I'm linking within the next, as soon as we get those printed, within the next 2 to 3 weeks, I'm hoping, fingers crossed, you'll start seeing that in the newspaper as in and out. I'm hoping that right now, when we do inspections from here on out, we're actually going to list in the paper the violations that are out of compliance, because it's what I'm instructing the staff to do. When you go write something up, only write the ones down that are out of compliance right now, because if not, it's going to be a whole bunch of verbiage on a piece of paper. So that's where we're at.
Perfect. Thank you for what your team does. That's amazing.
Yeah, thank you. And along with all that, I'll give you more update, but with this new code, we have to become standardized. So with that, I just got standardized by the state of Indiana, and it's a pretty lengthy process, a very stressful process. And my staff's currently undergoing training with me. So.
So any questions about the changes to the new food ordinance? I have a motion to approve the changes.
Motion to approve.
All right. All those in favor?
Aye.
Thank you.
Thank you.
Thank you. All right. So, looks like we're on old business now. Joni, the annual report.
Just want to let you know that our 2024 annual report is up online and on our website and available for viewing. We have 90 days from the first of the year to make that available to the public, and it captures all of our finances, our programming, all of our data that we collect throughout the year. So it's just a nice overview tool of the health department.
Any other old business? No. All right, program updates, vital statistics.
Hello. Okay, a couple new things in Vitals.
When you say your name to the new people, will know who you are.
Oh, I'm Loretta from Vitals. Hello. Couple new things in Vitals, the little packet that I gave you. We are now able to issue birth and death records from other counties. Was not supposed to go in effect until next year, but it is in effect now. With that being said, if you turn to the next page, you can see what the birth record will look like at the bottom for Vigo County. The next page, I just kind of took a birth record from Marion County. If you see where it says was born in Indianapolis, And if you see at the bottom where it says registered by, and then issuing, and then the next page, that's our application. We're gonna change the wording where it says birthplace. We're gonna change that to where it says county of birthplace in Indiana. So when they give us the application, we can see if it's gonna say Terre Haute or another county. The next page. That is our invoice for death paper, and the other one is for birth paper. I order that anywhere from 2 to 3 times a year. So, I'm probably gonna sit down with Mandy and Joni at some point in time before the next meeting and ask for maybe a raise in the, fee, sorry, thank you. The fee in our, totally lost, sorry, a fee,
Yeah, okay, so different counties have different amounts that they charge for their death and birth certificates. Ours are pretty low, and so what we're concerned is that we'll get an influx of individuals wanting their birth and death records from Vigo County. So one of the strategies that we've talked about was having a sheet that has all the different county death certificates and birth certificate fees. And so if somebody comes in from another county, to make sure that it's posted, of course, approved through our board and the commissioners, to charge them the fee for their county.
that's when, oh, sorry,
Go ahead.
sorry. When you keep on going on the next pages, I've given you all the counties and all their fees. So I will talk to Mandy and Joni about what maybe we can raise them to, or keep ours at $10. And when they come into the other counties, that we charge them their amount. I don't think that we should raise our Vigo County fees. I think that we should be able to charge their amount that they're coming into our county getting their birth records. I would like to maybe talk about doing that.
And that would help offset the cost, the paper
Yeah.
cost.
And then the second change is the last paper. We are no longer allowed to do gender changes to our birth records. So far, I've only had one of those that I did send to the state. I have been checking on that, and I have not heard anything back on that one. I don't know if they're gonna get back with me on that, or if they will contact the person that asked to have that changed.
I would say at some point we'll have contact, because if they give them permission to move forward, then we would have to alter the record. And I guess if we don't hear anything, it means, like, I think Monroe County said that they were gonna continue to issue them because it's a court order and the judge says so. We're gonna go by the order. And the governor, yeah, the governor's order.
That's all I have. Do you have any questions?
There's a lot of changes. Thank you for
Yeah.
working.
So by next meeting, I'm hoping that we have the things in order about the prices and stuff, and then we can talk about it more then.
I was just gonna ask you, is that gonna have to be an action item to vote on to adopt those county by county fees, or is it something we can do internally with Golden Utah?
No, we would have to do it in an open session, and we could just have it where the language would be an umbrella language to accept the adoption of charging the fee from the county in which the birth certificate was registered.
Okay. Thanks.
Thank you.
Thank you.
I agree.
All right, social services with Molly.
Good evening. I've been under the weather, so that's why I kind of sound like a man tonight. You know that we had added an intake coordinator to our team. The individual switched to Jeremy, so he's our new intake coordinator. I wanted to talk about something that Jeremy just took it upon himself to kind of put in order. Goodwill has agreed to do vouchers for individuals who need clothing coming out of jail. And we had a young lady who had just gotten her kids back and didn't have anything, and he got that started through that situation, and I was super pumped about it because I had talked before about some of the barriers, and the clothing was a big one. We're still doing MRT, change program, peer coaching in the jail, and since I seen you last, we also added Seeking Safety. Are you familiar with that? Everybody is? Okay. Seeking
Only
Safety is a PTSD and substance abuse trauma-informed treatment program. It's a 25-week. You can split it up and pull topics out individually. Like what's the word I'm looking for? Like individualized treatment. So what they're specifically struggling with, you can pull specific ones out and just do that. But right now, we're treating it as a 25-week program. And the judges and some of the case managers who are on their team are actually doing a pilot program right now and doing Seeking Safety on their end as well. I don't have the statistics in front of me. I wish I did, but it's an evidence-based program that has been super successful in the past. And some of the core principles of Seeking Safety I brought here so I could talk to you guys about. So its focus is building strengths, and it rests on 5 key principles. Safety first. So above all, the goal is to help them feel safer physically, emotionally, and intellectually, or relationally, sorry. And then it's integrated treatment for the trauma and substance use, and they're addressed together, recognizing the way that those two intertwine. How, one feeds the other one and makes it, I can't think of the word, sorry. But it focuses on ideas. You'll identify and work toward your values as a participant, helping you reconnect your sense of purpose, because, through all of this, you lose your purpose in life. You forget what that is. And so these topics throughout this treatment help them to make those connections again, to find that purpose in living, which is super helpful for them. It helps them learn about coping skills, how to utilize them, which ones work best for them, and helps them manage life's challenges without the substances, right? And it also, the last one is whole person care. This approach looks at all aspects of their life, their thoughts, feelings, actions, and relationships. And so it's a really good program. I'm super excited to add it to our list of things that we're doing. And I have one class that's 7 weeks in now, and they absolutely love it. And, in every topic that we went through, even the ones who didn't relate to it fully, were like, I took something away from this that is definitely going to help me. So I'm super excited about what this is going to do for their life and how it's going to shift their future. I brought the numbers like I give you every time. What we're doing now. So currently we have 89 participants that we're peer coaching. This year alone, we've had 26 graduates MRT, and the total participants in the MRT program are 123 currently. The number of individuals we have been working with who have been released is 11. The number of individuals in the change program, the interactive journaling that we do, is 88. And Seeking Safety, we have 103 participants in Seeking Safety. And the judges and the social worker that works for the court system, Virgil Mackey, he sends me emails. Here's a list of individuals I'm referring to this program. And so what we did going in was, okay, we capped it at this many for each block to leave spots open for when they send someone and say, okay, we need these individuals in there. And so it's worked out really well. some of the things that we've done, the meetings, events, and training, we attended a Faces and Voices roundtable discussion about community partners, how we can better work together, and it was helpful and really I was able to make some connections that I hadn't been able to make until then, so it was really cool. We went through an ethics training, which is super important in this line of work. You know, sometimes those lines can get blurry, and so we have to make sure that we can, you know, stay up on that. You guys know, yeah. We all went to the Circles of Change, and I was super excited to be asked to sit on that panel to address, you know, how we can better serve the families who are dealing with substance abuse issues. And it was the first time I'd ever sat on a panel, and I was super excited about it. And for once, I wasn't nervous, like getting up in front of all these people. I was really calm, and I actually prayed about it before I went up there. You know what I mean? All the things to try to, and it worked because it was perfect. So very thankful for that. So you guys remember Gary, right? Today, I have PJ Roberts back here. He's going to come up and tell you a little bit of his story. PJ was one of the first faces that I seen when I went into the jail last year, and I think we started going in late January, early February, and he was facing 28 years. And I went to court and advocated for him. They put me on the stand and asked me, you know, I asked if PJ could be, you know, one of my participants that I follow real closely. I mean, I follow them all closely, you know what I mean, but they didn't want to let him go. And so I got up there and advocated for him, and I said, give him a chance. Let me try to work with him, and it's been a great experience. He's excelled at everything he's done, and he's doing great, and I'll let him tell you all that. But the judge asked me, why do you want to pick him? And I said, well, I need a challenge. So I'm going to let him come up and talk to you guys if you have any questions for me before I let him.
I saw Molly present at Circles of Change, and she really did an amazing job. It made me proud that you represented the health department and just all the great work that you do.
Thank you. Thank you. All right, PJ.
My name's PJ Roberts. I was born in West Terre Haute in 1985. Broken home, broken family. Addicted to meth at the age of 13. Was molested. So I started going in and out of jail, hopping from parents' house to other houses. Sorry. So I went to prison when I was 19. I didn't get out till I was 33. So I spent most of my childhood in prison. I got out, still addicted to meth, and I went back and forth to prison 3 or 4 different times. And then I met Molly and got into the MRT program, and that's when I knew that I had enough with the life that I was living. I knew that I needed to make a change, so I took it seriously, and now I was released from jail in community corrections. I went over there to dual diagnosis for 9 months. I completed their whole program with no write-ups, no failed drug screens, held a job, 2 jobs actually. Went from there to home detention where I'm at now. I have 6 months left. In that time I've got my license. Got my license. I've opened my own business. A whole bunch of stuff's happened in the last year. A lot of good stuff though. Right now I'm on the panel for Anna Branch, so I go inside Anna Branch and I speak to them every other Sunday. I go to 4 AA meetings a week. I take that seriously. I go to church every Sunday, so life's great. And I knew I just had to make a change, and that's what I did. And if it wasn't for MRT and Molly coming in my life, I don't think I would be here standing talking to you guys. So thank you.
So I brought Gary back just to give you an update about what he's been doing. He's been doing great too. He just came from work, so that's why he's all dirty. Thought I'd add that in there because I'm worried about it.
Yeah, I'm going back to work too after this. So I've been doing real good. I've been staying in contact with Molly. I haven't really took care of myself, like health-wise, my whole 37 years of using and all that. So I didn't really know where to begin whenever I lost my hip. When I got out of jail and got this job out, because I had a good job now, and I lost my hip. So I didn't know where to go to get insurance at, and Molly got me on actually paying for my own private insurance now, and that feels pretty good. And got me a healthcare provider. So I've been going and seeing the doctor. I got on some medications for my high blood pressure. Doing things that I never would have done before. You know what I mean? Everything's looking good for me. So that's really all I got right now.
Thank you. Do you have anything for me? Any questions for the guys?
I have a question.
Okay.
I know one of the things I think we've talked about looking at is reentry back into the jail with some of the people you've worked with. And I don't know if that's being looked at too,
Reentry,
rearrest maybe.
yes, like the numbers?
Yeah, especially like the 11 that you've been working with after release.
Yeah. So there was 3 of those people that stayed in contact with us that got rearrested. There's a lot more that has gotten rearrested. I don't count those because they didn't complete everything. They've been to our classes, but that's why I don't count them, because they didn't do the whole thing. You know what I mean? I see them in there all the time in that jail tracker. I have talked to Derek Fell, though, about really tracking the recidivism numbers, like from their side, and he can do that. But I felt like the best time to do that would be the latter part of this year, because it'll be the end of the 2-year cycle that we've been going in.
Well, and that compared to the overall,
Yeah.
rearrest. So it's not going to be perfect, but
Right.
if it's, improved with your intervention, yeah.
But I'm
I'd be
hoping that
curious,
there's
yeah.
some improvement, Yeah. Anything else?
Just thank you to the 2 gentlemen that spoke. I know it takes a lot to get up in front of a big group of people and talk, and thank you so much.
A few weeks back, Sheriff Fell posted on Facebook a synopsis of what the jail programming update is, and it was extremely powerful. If you didn't see it, I'll text it to you. But it was nice because the local media covered it, and it was that we are making a difference. And we recognize, that not everyone's going to succeed, but if you can reach 1, 2, 10, 20 people, it can make a difference not only in that person's life, but their family, their friends, and the community.
PJ wanted me to let you guys know how long he's been clean.
Yeah.
3 years.
Oh, that's awesome.
Very good.
Thank you. All right, environmental, Amanda?
Amanda Poehler, Environmental Health. Micah, if you don't know, environmental health covers the installs of septic systems and permitting those, body art establishments, so we inspect those, public swimming pools, all of the restaurants we inspect and license, along with the swimming pools we license, and then general complaints. So we have a lot that we cover. We also are, we're also lead risk assessors, so we work with the nursing department and our lead caseworker on kids that have an elevated blood lead level of 5 or above. So when they're diagnosed with lead poisoning, we go into the home and find the lead hazards. So the environmental division, we are still working with Inspect2Go on getting that program up and going. We're very, very close to have a fully operating program. I'm thinking within the next month we'll be utilizing it completely for all areas that we cover. The environmentalists, they've attended the Spring Indiana Environmental Health Association Conference, and along with the septic side, they went to a wastewater committee meeting and attended some other trainings where they were certified. The beginning of the year is when we do issuing of our permits. I know I spoke last time on it, but I have a little clearer picture on how many we issued. We issued over 500 permits for our food establishments. That does not include our temporary events or any upcoming events throughout the year. Usually we issue around close to 1,000 permits when the season's done. Right now, we are working on getting our pools reissued with their permits, and along with the food permits in January, we also do our tattoo places, along with the body art artists. Both divisions are gearing up for our busy seasons. You know, the warmer weather hits, that's when we get busy. That's all I have to report. Along with the new food code, I'm going to put that in there too. Along with the new food code, we know what the changes. We're going to be making up a template, sending it out to the restaurants to let them know what's coming. With the new changes to the code, we can't fully enforce those per state until January of 2026. So, any questions?
One of the bills we've been following is the state wants to take our food trucks and do something different. And I'll let Mandy explain that.
Yeah, thanks for bringing that up. Under this bill, they are wanting to take the mobile food trucks and state license them. So that means, like right now, our mobiles are specific to the county, so they can get a yearly permit in our county. If this bill goes through, then the counties will be issuing the state license. So we will still inspect the trucks, approve them, but we will license them as a state license. And the fee is what I'm being told is over $400. We will keep a portion of it for doing most of the work, but then the state gets a portion. So I think we get like $200 and the state gets $250. They can go anywhere in the state of Indiana. And I have a bunch of questions about this, so I'm going to reach out to the state to see if I can sit on the panel. Because I'm like, what if we get somebody that's from Marshall that wants to get a yearly permit? So we have mobiles right now that get yearly permits that are from out of state. We let them, as long as they bring it to us and we inspect it. So I've got quite a few questions that I want to ask over this whole mobile thing. Right now, if they get their yearly mobile, it's $150 for the pre-approval process. So they have to submit an application along with their menu, a drawing. We approve it, then they get the permit, and it's, remind me, Tiffany, because off the top of my head, $125? Yeah. $125 every year. So the $150 is a one-time fee, then the $125 is just yearly. But I don't know what other counties charge off the top of my head. So this would allow them to go anywhere in the state of Indiana. But they're subject to inspection by that county. A lot, I haven't really asked.
And they may not be aware of it.
Are we, we're not set up to charge for inspections of somebody that's previously licensed, or so if somebody that's licensed in a different county for statewide or whatever, if we have to inspect that truck 14 times during the year, do we charge for that?
No. We would do the paperwork, do the pre-opening inspection, gather the funds up, send them to the state like we do coroner's fee, do all the work.
And if they show up in our county for an event and they're there and we inspect them, we don't charge them.
Okay.
So our oversight's kind of gone. So. Okay, any questions? No? All right, thank you guys.
Thank you.
Shelby?
All right, good evening. My name's Shelby Jackson. I'm public health educator and media coordinator. So within my quarterly report, January started off with National Radon Action Month, and by golly, were those a hot commodity. When I ordered these radon tests, they were provided free from Indiana Department of Health. I ordered them late Q3 of 2024. I had no idea what number to order, so I just did 50. I didn't want to order 200 and have a surplus in my office for 5 years. If I knew how many people were interested in radon tests, I would have gotten a lot more. We currently have a list going. I still get random emails and calls asking if we have these radon kits. So we were able to get 50 kits, disperse them into the community, I think within like 24, 48 hours. It was 2 days. I saved them for the very last week of that month because it's the action week. And it was crazy. Some people were very upset that they did not get their radon tests. Both Menards do offer these. It's about $13, $15. I tried to see if we could order them at a discounted rate if I got, X amount of radon kits. Unfortunately, they do not do that because postage is included in that. So the individual could complete the radon test, seal it, and send it, and it's already paid for the postage. So we don't really get a discount. Fingers crossed, and I'm keeping my eyes out open to see if Indiana Department of Health allows us this opportunity again for 2026. If they do, I'll probably bump that up to about 100 to 150 tests. So from the 50, I only received 2 tests that had high levels. We didn't get a report from individuals unless they called, and that was mainly because they had higher levels and they were asking about remediation services. So we were able to connect them to get the radon a little bit less of a level within their home. I partnered with Clay County Health Department for this past quarter too, and we were able to train over 30 Little League coaches in West Terre Haute in CPR, first aid, and some environmental emergencies before they kicked off their spring T-ball season. At the bottom, I did this report before I did my annual public health fair for all employees. So on this report, it says that we do have Narcan and some harm reduction supplies. We currently do not. It was swiped clean at the health fair, so I'm just waiting on an order to get that stock resupplied. This month kicks off our first month for having ServSafe, so I went through the process of becoming a ServSafe instructor, so that way we can offer it here to anyone. It's not limited to Vigo County residents, but they can come here and get the ServSafe certificate. I do have flyers for each of you guys if you'd like to take them back with you. It has all of our dates listed. We have some different payment options that kind of correlates to the person's individual needs, but the majority for the book, the class, which is an 8-hour class, the answer sheet as well as the exam itself is $160. So when we found out that B&B was closing, we hurried up and jumped on this as soon as we could. Pretty much the last Wednesday of every month except for December just because of the holidays. I was a part of the Indiana Department of Health Social Media Strategy Series, and it was kind of a 6 to 8 week training on different tactics involved with social media. Also partnering with Purdue Extension, I sent each of you an email earlier this month about the food insecurity screening on April 21st. I also have a flyer for that if you would like to join us. We're trying to have a packed house for this second screening of food insecurity put on by Catholic Charities and Purdue Extension. I've also become certified in Stop the Bleed, thanks to the Clay County Health Department. We did our first hand washing tent event of the year, so about 130 students at Head Start. Attended the Public Health Day at the State House. It was packed this year. It was very fun to see new faces and old faces. And lastly, I'd just like to call attention, our numbers within our social media. It's the very last page of my report. It's a 3-series column, and this is just for one social media app. We have grown tremendously since Q4 of 2024. And we're hoping to continue on that path and maybe even get some more applications for social media. Are there any questions?
Thank you, Sean.
You're welcome.
All right, Mike, Vector Control.
Good afternoon. Mike Gregulis, Vector Controls Supervisor. We finished all of our maintenance on our vehicles and our ULV machines. We've got them ready for calibration and droplet size testing, which is scheduled for April the 29th. Before we can do any adult sighting in the county, that has to be done every year. We've ordered our chemicals for the upcoming season. We began our tar amnesty program April the 1st. We've already filled one trailer. This year I did find out that the city code enforcement is also picking up tars throughout the city. And the solid waste district is also accepting tars. So we've got some other partners that are helping us keep the tars out of the community. But we've filled one trailer already and working on the second one. We haven't run any of the alleys or streets yet because we've been just handling what the public's been bringing to us and getting our equipment ready for calibration and testing. We sent out our letters to our tar retailers reminding them of the tar storage ordinance that at that time of the year again, that runs from April the 1st to November the 1st. It's illegal to store tars outside. We sent in 6 bats for rabies testing. All came back negative. And we've been treating 3 houses for rats. I know, Amber, you like that.
I did, yeah.
We're wrapping that up. That should be wrapped up tomorrow. It's been a couple weeks since they've taken any bait, and we haven't seen any new fresh signs of rodent activity, so it's about time to close those down. But we've been staying busy, and I expect that we're getting a lot busier as the summer comes along. So anybody have any questions? All right, thank you.
Hey, Mike, any 1 or 2 day events planned down at the fairgrounds this year? Anything for the tire amnesty?
No. We found it to be a lot easier, Doctor, if we handle it by month like that for a month long. It's easier for the public because they don't have to sit in line, wait in line. We've had a lot of people comment about it. They like it this way because all they have to do is just call us, make an appointment, bring them to us at their convenience, and we unload them, of course, and they like it. And I think it actually works better than that one-day event, because we really don't have any control when we do the one-day event. You don't know who's bringing them and where they're coming from, and we ran into that the last couple of years that we had it. Joni will tell you they had people sitting outside the fairgrounds on the back side actually bringing in tars, pickup truck after pickup truck loading them off semis. And we didn't have any idea where they had came from. But you couldn't turn them down because everything that we had out there publicly said, bring us your tars and we'll take them. So this way we know where they're coming from. We get an address from the people. If it's more than 10, we can go out there and we can check, give them authorization to bring them. It works out a lot better, I think, this way. Yeah.
And the one trailer we've already filled is a 53-foot semi.
Yeah.
So we had to have another one dropped.
Yeah.
And so we do the month-long tire amnesty, and then we have our 4 interns from last summer coming back, and then we've added an extra one.
Mm-hmm. Yeah, and we had, I think it was right at 1,000 tars we were able to get into the semi-trailer this year, which that's about average, is about 1,000 tars. So the guys do a great job of stacking them and everything, and we just don't throw them up in there. They stack them, so we get as many in the trailer as we possibly can. So we'll end up with 2 or 3 trailers like what we did last year. And like I talked with Shelby a while back, it should decrease every year. If the program's working, the numbers should decrease because you're taking the tars out of the community. So we're seeing a little bit of a decrease, and that's good. I have no problem with it. Any other questions?
Is this year the 20th anniversary of
Yes.
us doing it?
Yes. You've been here that long, Joni. I have
No,
not, but
you liar. We're decades and decades into this. And then make a guess on how many you think we've taken out of the community in that 20-year timeframe.
Over 100,000 easy.
Easily, that's what I
Yeah,
was gonna say.
because we averaged 10,000 that first year, over 10,000, and normally average 7,000 to 8,000 per year. So, yeah.
And our tire amnesty program has won awards at the state level. We've presented on it at the federal level or national level. But it's just been interesting to see other counties wanting to adopt it. Knox County called and asked Mike
Yeah.
sequentially how you put one together, and it's just nice to see everybody working together, code enforcement, solid waste management, but all of us knowing that there's such a breeding ground for mosquitoes.
Yeah. Yeah, they all get recycled.
No, we use
No.
an IDEM certified hauler, handler, and recycler. So we have to use one that's, falls under the jurisdiction of being certified through IDEM. But they make playground mats, tracks, industrial mats.
Yeah. Goes to a good cause. And it beats the heck out of them laying out along the roadside collecting mosquito larvae and mosquito biting you, Dr. Lim, and you getting upset at me for that. Then our relationship just wouldn't be any good, and that,
He
you know,
could-
it just trickles down from there. I
He
mean,
might turn into a mosquito like that Jeff Goldblum movie where he
Yeah.
was a fly.
Thank you, Mike. All right. All right, Robin with the clinic.
Hi, I'm Robin Maurer with the clinic. We are looking to have a wonderful start for 2025. We're looking forward for the upcoming year and being a positive force for our community. We're working on our vaccine administration, case management. We're anticipating an uptick for our kindergarten roundup. We are heading off to Head Start for lead testing actually on Tuesday. We are hosting a vaccine clinic at the YMCA next Saturday, the 26th. So in July, I'll be able to give you the numbers that we have for the kiddos that we test for lead and at the vaccination clinic. We aren't hosting the YMCA clinic. They asked us to come and vaccinate. So it was kind of a last-minute clinic. They asked me 2.5 weeks ago to do this. So normally with these clinics, we have to give state 30 days. But Tom Keller is really good with us, and he got it pushed through for us, and we're looking forward to it. The nurses have attended several state meetings in Indianapolis, and Kayla, our school health liaison, has done some things I would like her to come up here and talk about. She's trying to work with the private schools right now, and she has had some very positive input from them. So I would like to bring her up here and let her talk a little bit right now.
Hello, good evening. I'm Kayla Terrell, the school health liaison. So I think the last time I was up here, I was talking about the mobile dentist. They did come to Highland Academy, and it's a private school. It's in West Terre Haute. They did assist 22 children. There was a couple more on the list, but they were like absent that day. They did cleanings, the oral exams. They will come back every 6 months. It was great. I was there with them all day. The kids did really good. They also have a daycare that's connected. So they did ages 18 months to 18 years. So even the littles, it actually wasn't that bad. They will come back and also do any like work that's not like major, so like cavity fills. They'll come back and do like, they're not cavities, but they're like fill-ins, like. So that was good. And then I'm looking forward to going back and doing that with them every 6 months that they come back. In February, I did a couple of Zoom meetings with IDOH. On March 11th, went with Shelby to the Head Start, and we did the hand washing. That was my first time, and that was fun, interesting. I just had a phone meeting with New Life Academy. I explained everything that we were able to offer, the mobile dentist, hygiene products, the hand washing tent, and they were pretty excited. So I think that's going to be a pretty good thing. We're going to start scheduling some things for the beginning of the school year. And then I in the process of meeting with Eastside Christian Academy, hopefully meeting with them tomorrow. That's the goal. On March 28th and 29th, I went to Richmond, Indiana with Highland Academy. We went to a Caring Cradle conference. It's going to be launching actually this evening at 7 p.m. It's parenting classes. So far, the only people that we know that do parenting classes, I think is Crisis Pregnancy Center maybe. And this is open to the community, whoever wants to come. There's going to be childcare provided, resources, incentives available to the participants that come. So we're excited to launch that this evening. That's it. Any questions? Thank you.
And I have pictures. We have actually did renovations to our clinic, and if you have ever been into our medicine room, it used to be little bitty. Now, our printer is not the best printer for pictures. There is a line in that picture, so it does not look the best. But those refrigerators all used to be in one part of that room. So if you could imagine the heat that was in the room, and so we would have to keep the air turned down in the one part of the med room. So they were gonna knock out the whole wall in the med room. They could not because there was a support wall. So we had to just knock out a part of the wall, but it is not completely finished. They're doing some, of the cabinets, they're finishing the cabinets, getting some new countertops. So I'd say within the next month, they'll be completely finished. The flooring is now in. So I would love for you guys to stop by and see it, because we do have the big double-decker fridge. I call it Big Betty. So it put off a lot of heat in that one room. You couldn't even open the door all the way. So Joni and me had talked about it in January, and maintenance was wonderful with getting the work done, along with the construction crew that came in and did it for us. I am also very excited to say we have hired another RN. She starts on Monday. So we'll be busy getting her trained, and within the next 6 to 8 weeks, she'll be ready to vaccinate. Also, we continue with our court-ordered DNA testing through LabCorp, and STI and HIV testing, which is provided monthly through Positive Link. I didn't know if we've ever spoke about that, and you guys knew that we did that type of testing. It is just, we provide the facility and they come in and do it. So we don't do any of the scheduling, but we provide the building for those services. Other than that, we're looking forward to, vaccinating and finishing the cases. And COVID, I mean, we don't trace COVID anymore, or
We don't do any of the contact tracing or anything because the quarantines don't exist any longer, so, and it's not, Jimmy, you can speak to Union, but we don't see it at the other hospitals right now. It's very, very few, and they're kind of COVID adjacent, diagnoses. Old folks that are still taking blood pressure pills get a little dehydrated when they just get sick. It's like any virus can do. No, COVID has established itself. It will be endemic from now on. It's not going anywhere, so, but, it's lost its punch as far as, it still has its infectivity, but its degree of morbidity has gone away and does not look to have any inclination that it's coming back with any vengeance, so.
we do still carry the vaccine, and the older generation still does come in and get vaccinated for the booster of COVID.
So right now, it's still being recommended seasonally. It's going to depend on your risk factors and things. There's not a formal recommendation out there per se, and it's likely to change in the next 2 years as well. So I don't know that they'll be doing a lot of revamped COVID vaccines. They used to change them as the virus. Still really pushing for people with advanced, with risk factors for severity of disease.
So, thank you. Any more questions? All right, thank you.
I add one more thing? Yeah. Sorry. Anyhow, with this new food code, I want you guys to think about something. with it being an in and out inspection, or not observed, not applicable, we have talked and we would really like to, in the future, add a letter grade. So weight the questions or the violations based on the numbers. They get a score, and then we'll give them a letter grade and have them post it on their front door. And I've done a little bit of research so far. There's one county in Indiana that's doing it, and it's Fishers. They do A, B, and C grading. Anything below a C is automatic closure for a temporary amount of time. It's written into their ordinance. Then once they are reopened, they automatically get a C until their next inspection. So C is your bare minimum compliance and so forth. So just something to think about, because visually I think it would be good for our establishments. I'd also like to have them post their inspections on the front door, somewhere visible to the public, so.
I think that's common in some other states, that you have it posted.
And I think it'll be really easy to do with this new code and new way of inspections. So I'll do some more research and present it next time.
I have some things to add also.
Yeah.
One of the things that I had Robin add to your packet was the Health First Indiana evaluation. And it was, basically they chose 3 core service areas: prenatal care, blood pressure screening, and fall prevention services. And it was estimated that over $141 million in direct and indirect cost savings from the first year of HFI implementation. So it's an interesting little document to go through and see just with those 3 core services what we were able to save. That was my first thing for you. Second, we did add another partner to HFI, which is the former Crisis Pregnancy Center. It's the Crossroad Care Clinic. Steve Holman came and advocated for it. It unanimously passed through our council. They're also a partner with Union Hospital with their Healthy Beginnings grant. And it'll just augment their services that they already provide, such as their mobile maternity sonogram, pregnancy testing unit that goes around to Vigo County and to other outlying areas. So that was a nice partner to add, because although Union is a partner of ours, we haven't had us having any of our direct partners that we fund do maternal and child care services. And then lastly, the county commissioners and IT had talked about doing a how-to section for our website: how to get a marriage certificate, how to get a birth certificate, just different services that the county supplies. And I was fortunate enough to have Lily Yeagley come back to us this summer. She got accepted into the Erasmus program and will be doing her master's in public health in Denmark starting at late August. So she's going to come to the health department, and her and Greta Paff, and they're going to do those this summer, the how-to videos. And Lily is fluent in Spanish, so we'll have them in English and in Spanish. So it'll be a super cool project, and they both are really cool young adults. So I was happy to see that added. But that's all I wanted to add to mine.
All right, next up we have citizens input. Is there anybody here from the community that has anything to say? All right. Anything else before we close? All right, can I have a motion to adjourn the meeting?
I motion.
I'll take that other one as a second.
Who was the
All
other
right,
one?
all those in favor?
Aye.
All right, thank you so much. We'll see you in July.
Oh, no kidding.
Here?
Yeah,